Well, it was a bit of serendipity really. I'd been working in general practice for 15 years and an ex-colleague had moved into skin cancer and gave me a call one day and asked me wouldn't I be interested, and I thought I would. In general practice we do diagnose a lot of skin lesions and do quite a lot of skin cancer work, but I never felt that I was very well set up to do it. It was always in between other patients and you could never find all the equipment, so I always found that it was a rather inefficient way of doing it. So I thought even if I was going to learn extra skills that I could apply in general practice, that would be great. So for the first year, I worked in both. I worked half-time in skin cancer, half-time in general practice, until I decided after a year that this was really my field and I really enjoyed it, and that's when I decided to move full-time into skin cancer practice. I've been working in skin cancer for 15 years now. I think the same things that make a good doctor in any area, and I like to think of the 3 C's. So genuine concern for patients and excellent clinical skills and good communication. I think that's important in every area, and in skin cancer, the clinical expertise involves dermoscopy and diagnosis, and it involves improving your skills in the treatments, so that's the topical treatments or the cryotherapy, and especially the surgical skills, and that's something that's a never-ending learning experience, which is part of why I love it. The collegiate environment, I like working in a group practice. We're a small group, and the feeling of being part of a community. There are many other doctors throughout most of Australia that we meet at conferences, and so we feel part of a group. And also the annual this conference that SunDoctors has, the in-house conference, that's really great to meet the rest of the SunDoctors community, and it's also really great for learning and improving your clinical skills. So the other things I like about working at SunDoctors is that SunDoctors realise that continuing medical education is essential, and to that end they do sponsor the 1 episode of clinical education a year for doctors that work at least 3 days a week, and I think that's very important because that is not very common in medical practices these days. And also another thing that's important to me are the flexible hours and the flexible holidays, and I think that really enables you to combine a great career with also a good lifestyle and family. I have 3 children, so it's really important for me to have time with the family as well. So yes, I've gone through the Skin Cancer College Australasia and I find their courses fantastic. So starting with the 2 certificates, and now I've done the diploma, or it's now called the Advanced Certificate of Skin Cancer Medicine. That was fantastic. I think that was the #1 course for me because we learned a lot more surgical skills, starting with flaps and grafts, and just to do really good ellipses along skin lines. And the other one that I've just finished is the Advanced Certificate of Dermoscopy, which is absolutely fantastic as well. You get such a detailed knowledge of dermoscopy. It really improves your diagnostic skills. And there are the annual Skin Cancer Conference in the Gold Coast every year, which I recommend people go to. And then there's lots of other courses run by the labs and things like that. I think you just have to keep learning, like in any area of medicine. It's very important. I would say just do it. I think it's a fantastic area of medicine. A lot of people think, well, it's just a small subsection of a patient's health. You will only see patients once, you'll never see them again, but that's not actually true. I find over the years I've got to know so many of my patients' families, grandparents, children, aunts, uncles, because you do see them regularly. You see them every 6 months, every year, every 2 years. So it's a little bit like general practice in that respect, that you do get to know them. And I find too we can provide a really good service from diagnosis to discussion of management to management, and only in a small number of cases do we have to refer. That would be cases that maybe request plastic surgery or that we feel are just too big or too difficult to manage in the practice. So it is really satisfying from that point of view.